morning, good morning, and welcome to the Circuit Havana. Welcome to Jakarta. And this morning we're gathering here for the kick-off meeting of the Inter-University Consortium for Global Health. And we'll commence directly our remarks with a report first by Dr. Yodi Mahendra, IUCGH coordinator.
Assalamualaikum warahmatullahi wabarakatuh. His Excellency Ambassador of the Federal Republic of Germany to the Republic of Indonesia, His Excellency Ambassador of the Republic of Indonesia to the Federal Republic of Germany, Honorable Rectors and Deans, Consortium members institutions, Honorable Representative of our German partners, distinguished guests, ladies and gentlemen. We have gathered today for an important event, the kickstart of the Inter-University Consortium for Global Health. We know that global health today represents one of the key challenges for sustainable development. Global health is currently an important part of the Millennium Development Goals, and most likely it will remain to be an important part of the post-2015 development goals. Science plays a critical role for addressing global health, which is why contributions from academic institutions are much needed. That is why we feel it's very timely that global health has been chosen as one of the key areas to be developed within the framework of academic cooperations between Germany and Indonesia. Germany is a logical partner for Indonesia to collaborate in global health. Germany has been playing an increasingly important role in global health. The Federal Chancellor has facilitated high-level dialogues on global health policies by hosting the World Health Summits in Berlin annually. The federal government has developed a clear global health strategy entitled Global Gesundheitspolitik gestalten, to shape global health politics. And academic institutions in Germany have contributed substantially, such as the Institute of Public Health in Heidelberg, which has contributed substantially in terms of research and training for many years now. That is why, with the collaboration of our German partners, we propose to set up 5 centers of excellence in global health across Indonesia, namely in universities which are represented here: Andalas, Diponegoro, Gajah Mada, Mula Warman, and Sudirman. These 5 universities have signed a memorandum of understanding to establish the platform for this consortium. Within this consortium, we shared a common vision, which is evidence-based global health policies. We believe this can be achieved by establishing a network of academic institutions in Indonesia which can deliver high-quality research and training in global health. To do this, we propose to carry out 4 clusters of activities. Number 1, we will upgrade our existing research infrastructure, especially to establish population-wide surveillance sites which will allow us to carry out large long-term studies in global health issues which potentially could generate definitive solutions to global health questions. Number 2, we will also propose to strengthen our research competencies of our faculty members to be able to carry out high-quality research by supporting undertaking of masters, PhDs, and postdocs. Number 3, we would also propose to foster our capacity to disseminate research and also to network so that there should be a strong link between research, policy, and practice. And number 4, last but not least, We would also propose collaborative research to be jointly conducted between the Indonesian and the German partners. We have elaborated these ideas in the proposal which have been distributed today and which have also been submitted recently to be considered for funding under the upcoming scheme of debt swap 2 between Indonesia and Germany. We know, however, that the road to debt swap 2 is a long and winding road. So we would need the advice of His Excellencies and all of the key partners represented here today on how we could move forward strategically and effectively toward debt swap 2. In the meanwhile, however, we know that global health challenges is not going to wait for debt swap 2. It's already here. Climate change, non-communicable disease like diabetes, hypertension, cardiovascular, chronic respiratory disease is already affecting our population as we speak. So we will not wait for debt swap 2. In the meanwhile, we will already start activities, although it will be just a limited set of activities, such as joint workshop, joint trainings, and so forth, because it will be mainly based on available resources from the 5 universities. As we go along, of course, we would like to tap into other potential sources of funding. Some have been identified. For instance, we would like to tap into possibly the current scheme of debt swap 1. His Excellencies, distinguished guests, ladies and gentlemen, global health is a complex problem, and academic partnership is an important part of the solutions. Thus, we would like to request your advice and your support so that we could make sure our vision of evidence-based global health policies become a reality for the sake of better health for all of us. Thank you for your kind attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Lee. And now we move into the next remarks by the coordinator of IUCGH General Partners.
Thank you very much. His Excellency, the Indonesian Ambassador to the Federal Republic of Germany, His Excellency, the German Ambassador to the Republic of Indonesia, rectors, deans, colleagues, students, distinguished guests. Can I have the first slide, please? So I will present you the part that the German consortium is playing in this endeavor. And if you, can I click or will you click? Can you go on clicking? Yeah, you see this is now Heidelberg in the winter, so I was looking already forward to maybe your next visit in the winter time. It's also nice in Heidelberg, although it's cold. So this is the design of our center. It has a kind of Java house design. The roof is global health, as Yodi eloquently demonstrated the importance of global health. And the Indonesian side chose 2 very timely and very innovative areas where the cutting edge of global health research is. One is climate change and health, and one is non-communicable diseases. We believe that in both areas, Germany can make a contribution. If you go on clicking, please. We have now, for a little bit of detail, on the right-hand side you see the topics of climate change and health research. Extreme weather events, of which Indonesia is very well a victim and aware of, will be increased by climate change. Dengue, malaria, asthma, cardiovascular diseases, and malnutrition. So these are the topics that we have selected so far. On the other side, to the left, prevention and care of non-communicable diseases. Germany is well in the transition to non-communicable diseases. It's our main problem, and it is already becoming and already is a main problem in Indonesia. In fact, we had a conference on this topic on Friday last week, and we saw that 60% of deaths in Indonesia are caused by non-communicable diseases and not by the diseases of poverty in inverted commas. Cancer, cardiovascular diseases, diabetes, and lung disease, they were chosen because they are contingent on 4 risk factors: fat, sugar, lack of activity, physical activity, and high blood pressure. So this is the substance area, and all this is built on a strong foundation in black of research capacity building. And the idea is that we help in training, equipping, and also in maybe suggesting innovative career structures. I will talk a little bit of this, scientific career structures, to our partners here, that we share study cohorts, population-based study cohorts, and of course that we do collaboration, joint proposal development for German, international, and Indonesian funders. And all this is linked, of course, together. We had one presentation on the link between non-communicable diseases on climate change, and all this uses the research capacity which I just described. Okay. The German consortium consists of 3 institutions so far. Maybe others will join, we have to see, but for the moment it's Heidelberg University. We are the consortium leader, as Gadjah Mada is, for the time being, the consortium leader on the Indonesian side. We have some expertise in global health, public health, health and climate change, cardiovascular diseases, diabetes, and lung disease. And I was very proud to host a delegation of 3 universities, 2 deans and 1 representative of a 3rd university of our consortium here in Indonesia, 2 weeks ago, and we visited the head of cardiovascular diseases. We visited the German Cancer Research Center, which is the next on this. Oh, I was pointing to the screen. Sorry, I'm not a high-tech adept. So the German Cancer Research Center, it's German, it's not Heidelberg University, a very prestigious institution. We met the director, whose name is Wiesler, Mr. Wiesler, but with an IE, and we met him in the delegation. And then the Potsdam Institute for Climate Impact Research, which is very well known worldwide, and I have yesterday talked to the ambassador of Indonesia to Germany. He knows very well their work and their work in the IPCC and the climate conference, the COPs. So these are the 3 partners, and you see they fit nicely with the topics that I just outlined, and we hope that this is a really productive collaboration. Sorry, it's the wrong way. The roles and tasks of the German partners, and here we will get a little bit into the challenges already. Training of young Indonesian scientists at the doctoral level, and mind the bracket, comprehensive package, and I will explain what I mean by this. Postdocs, it's a career step that is not yet established in Indonesia, but we would strongly suggest that you create this and help us also train some of your most talented young scientists. And junior research group leaders, that's another step above. And only after that we have the traditional professorial senior scientist level. So we want to help train and build capacity in these 3 career steps. Then an exchange of students, staff, mid-career staff, senior staff, that is a classic ingredient in such a cooperation. And the 3rd point is not so common. The Indonesian side asks us to mirror, to establish the capacity that is established in Germany on these areas, also in the consortium in Indonesia. For example, this large population cohorts. In Germany we have now the German cohort, national cohort. We also have experience with such cohorts in other countries, so that would be one priority. And the Indonesian Climate Research Center could be a big elephant, if you allow me this term, of collaboration if the Potsdam Institute could be sort of transferred in terms of its strategic capacity and scientific skills. And mirroring modern scientific career structures, as I just said, postdoc, junior research groups, and then the joint competitive bidding, because we won't have this money forever. We want to be independent, both sides, so we can only survive with a competitive access to funding resources, of which there are many in the world. The challenges is that funding doctoral training is an old-fashioned business where you only target the person. and give him a ticket, a roof above the head, and something to eat, and the books, maybe a book grant. That is really the old-fashioned stuff which I've been sponsored by DAD. That way, I was very happy. But at my time, already DAD paid the tuition fee for an American university. So we think that it should be more than this. It should be fewer students, but more in-depth and more taking care of one student to make him really a star. So plus funding of the research of the doctoral student in Indonesia, plus specific method training courses, conference attendance, tutorial, administrative support. So a whole package that guarantees that this person becomes a star, maybe a postdoc, and then a researcher here. And as I said, innovative capacity building for junior researchers is the postdoc startup grant. They write their own future, if you like, their own grant and win it and are a postdoc, and these junior groups. Okay, I had this already. And this is it. And we should not forget that we are doing this not for science per se, but for the population, for policy, as Yodi said, but also for the population of Indonesia, for their health. And with this, ladies and gentlemen, I want to thank you. And I have, unfortunately, the thank you words never come out. Oh, yeah, I do. And they are moving. So thank you very much indeed, and I'm looking forward to this day of debate.
Thank you. Thank you, Dr. Bobo. And now, last few months, we are going to ask for Dr. Usasmada from his own party.
His Excellency Bapak Edi Pratomo, Ambassador of Republic Indonesia to Germany. His Excellency Bapak George Michel, Ambassador of the Federal Republic of Germany to Indonesia, Timor-Leste, and ASEAN, but mostly in Jakarta. And honorable guests representing Siomolek, Universitas Andalas, Unsud, Undip, Universitas Mula Warman, and also Pak Atase Pendidikan dan Kebudayaan Indonesia untuk Jerman, and distinguished guests and participants. Welcome to Universitas Gadjah Mada. On behalf of Universitas Gadjah Mada, it is a great honor for me of hosting the kick-off meeting of the Inter-University Consortium for the Global Health, and initiated by the 5 universities: Universitas Gadjah Mada, Unan, Undip, Unmul, Unsud, and also supported by the DAD and the Indonesian government, as well as the Germany government, and especially our strategic partner, the Institute of Public Health, Heidelberg University Medical School. And of course, this is we have listened that how important the issues of global health, and this is one of the development of science, but also how we serve for the community. Universitas Gadjah Mada, and I think other universities in Indonesia as well, has a strong commitment of improving the quality of education and developing new knowledge by research, as well as the community services, the 3 pillars of higher education that we try to do our best. And this forum shows us that we have a strong commitment to collaborate and also to generate new knowledge, as well as to improve the quality of education, and at the same time to serve for the better community. However, as has been presented, that we have some challenges that we have to solve. Dr. Yudi has mentioned about the problem of financial support, because the program should be implemented very soon. But the depth swap 2 will not be available for some time, as far as I understand. So, of course, that we need to solve the problem together. Each university can participate, how we can contribute to have the program can be implemented very soon. But of course, His Excellency Pak Edi Pratomo as well as Bapak Jodwichal, I believe can help us as well how we can solve the problems and so that we can execute our program in the very near future. The contribution of the participant on how we can identify the way we can solve the problem is one of the targets that we need to discuss today. So again, on behalf of Universitas Gadjah Mada, we would like to thanks for the support, for the strong commitment to work together to solve a very strategic issues that we have to deal not only in Indonesia but also worldwide. And I know, as Pak Duta Besar Jerman has mentioned, that he visited Indonesia long time ago when he had many times but limited cash. But now, long time ago, not now, but now, backpacker, several decades ago, but now with many cash, but limited time. But hopefully you still have time to enjoy Universitas Gadjah Mada and Yogyakarta, as Pak Edi has enjoyed sate kelada last night. Sate kelada, one of the special food of Yogyakarta. And so hope we still have some time to enjoy UGM and Yogyakarta. Again, thank you very much. Hopefully we have a fruitful collaboration for the development of science and the quality of education and serving for the community. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.